Hello, everyone. I am Leslie Enriquez. It is my pleasure to welcome you to the first episode of Let's Talk Community Health Real Issues, Real Action. This space has been created by Dia de la Mujer Latina. And every month, we're going to come in Facebook and YouTube. Facebook at Dia de la Mujer Latina, YouTube at Dia de la Mujer Latina, YouTube. Once a month, we're going to be talking with different community health workers and talking about issues and real action. Let's start today with some community health workers that came to Houston a few days ago, and let's hear what they had to say. Now we are here with
Benita Perales.
Benita Perales, CHW from Corpus Christi, Texas.
I am a CHW instructor and I am from Corpus Christi, Texas, and the surrounding area. I'm actually from a little town called Robstown, about 20 minutes away.
And tell us, what are the challenges that you guys face over there?
The challenges would be the distance in between. We do have Corpus. However, many of the colonias are 20, 30, 45 minutes away in areas where people are not getting the services that they need because they don't have the ability to get to the place where they need to be serviced. They don't have, whether it's the money or the transportation, or maybe they're not knowledgeable of the services that are being, whether it's in the Nueces County, San Patricio, Clayburgh, because that's all the surrounding counties where we're at.
Anything else you would like to add?
We need more people to be involved, to understand. We need our medical area. They need to know, hey, we're here to help you. Give us that opportunity. Let us get out there. Let us help the people. And the funding. The funding is not there. Many times, that's why it's so difficult to reach out to the people because there's no funding to get to them.
Amelia Day from Houston.
From Houston, tell us,
Yeah.
what are the challenges that you face in the Houston area as a community health worker?
That's a very good question. Our resources and barrier to get to the resources. So it's more about being visible in the community, making certain you bring those resources to the community and to meet those individual needs and those family needs
And how do you help them?
in every way I can by connecting them with various agencies, by bringing agencies to them, by contacting individuals to let them know, hey, I have this family that needs whatever resource they need. And so just making certain we bring that connection together with them to make the difference, whether it be with healthcare or even food.
We have many challenges. We still have a lot of myth, especially when it comes to some of the health issues. You name it, it could be diabetes. So misinformation out on social media sometimes create an issue with our communities because they get confused. And we as a community health workers try to clear those myths, try to explain them, guide them, bring them research to them so that way uh, they can make positive changes on their life. Uh, it could be different areas, when it comes to going to their regular checkups. It could be men's where, more often we have more issues for men to go do their regular checkups versus women's. So that is very important, and we have to break some of the barriers for them. One of them is creating their own believe on their own to go to the doctor and find out what the issue is versus being afraid of finding out what problems they may have. So that one of the things that we definitely as a community health workers work hard on, and it's on a daily basis. So anytime we have an opportunity to communicate or to talk to someone, we try to gain that trust to guide them and bring those resources to each individuals in need of that.
And we continue with Let's Talk Community Health. And right now, it's our pleasure to introduce you Venus Gines, the founder of Dia de la Mujer Latina.
You.
Thank you for joining us.
Leslie, I am so excited. We've been doing Hablando Entre Nos, and it's a program for promotores all over the country where they're sharing what's going on in their community. And many of our community health workers say, hey, why don't you do something for us that don't speak Spanish? And here we are. It's Let's Talk Community Health. We're going to be looking at the real issues and things that are happening in the community. But more importantly, we're going to actually work with our community health workers to promote action.
And I know that for a few years, people have been asking, when are you going to have the English version of this program? Tell us why you decided to create this space for community health workers.
Well,
Hello, everyone.
We try to gain that trust.
all over the country where they're sharing what's going on in their community. And many of our community health workers say, hey, when are you going to do something for us that don't speak Spanish? And here we are. It's Let's Talk Community Health. We're going to be looking at the real issues and things that are happening in the community. But more importantly, we're going to actually work with our community health workers to promote action.
And I know that for a few years, people have been asking, when are you going to have the English version of this program? Tell us why you decided to create this space for community health workers.
Well, we know, I think the research is showing that community health workers, these trusted members of our community, if trained the right way, where they